The Quality and Safety Education for Nurses Institute, QSIN, describes patient-centered care as the Quality and Safety Education for Nurse. The Quality and Safety Education for Nurses Institute, also known as QSIN, describes patient-centered care as the ability to recognize the patient as a source of control and full partner in providing compassionate, coordinated care based on respect for the patient's preferences, values, and needs. One aspect that could affect this patient's preferences, values, and needs is the healthcare environment in which it's provided. There are many different environments a person can go to for their healthcare needs, such as a doctor's office, urgent care, a hospital, rehab center, nursing homes, birthing centers, and even in their own home. Each one of those environments has a different effect on patient-centered care. For example, hospitals versus in-home care. At a hospital, a patient already starts off out of their element. Hospitals can be intimidating, and they could feel totally out of control. They don't have control over when procedures happen to them, when they see a doctor who comes in and out of their room. At home, they have total control of their environment, from the exact degree that their temperature is set at to their daily routines, when they wake up, what they eat. Also at a hospital, a nurse may have 5 or 6 patients, and it's easy for a nurse to get busy and get into a routine where they're providing care based on the client's condition versus providing care for them as a whole and really individualizing their care based on their religious beliefs or their cultural considerations and just individual preferences. So it's very important for you to provide individualized care and let the patient be in control of the environment as much as possible. Another example is home births versus hospital births. Many people are turning to home births over hospitals because of the environment and how they're encouraged to be a part of the birthing plan, and home births are a lot of times more family involved, and they can accommodate religious and cultural considerations easier. It's also a setting where there's no pressure to use medications, such as like an epidural, or interventions such as getting Pitocin, so they can stick to their birthing plan a little easier. Another aspect that goes into patient-centered care is cost, quality, and safety. Birthing at an in-home center or in an in-home setting can cost up to $2,000 less than in a hospital with a physician. On the other hand, if there is an emergency situation, the hospital is more accommodating and has more resources available, so that ties into the safety aspect. So hospitals have more resources to meet their actual healthcare needs when it comes to that kind of emergency situation. The takeaway from all of this is that you really have to communicate with your patient and find out what their preferences are. If they have any cultural considerations, religious considerations, and even preferences to temperature or anything. You have to communicate that with the rest of the staff and try and accommodate it as much as possible, and be mindful of the environment and how it affects all those preferences.